Hello everyone and welcome back. My name is Dr. Ben Osevwe, DNP-PMHNP, and today we are going to talk about generalized anxiety disorder, also called GAD, in a simple, clear, practical, and not too boring way. Because let's be honest, anxiety already talks too much. We do not need the explanation to sound like a 90-page insurance policy written in tiny font. This lesson is for PMHNP students, psychiatric providers, and anyone who wants to better understand generalized anxiety disorder, what it is, where it comes from, how it affects the brain and body, and how we treat it. By the end of this video, you should be able to explain GAD in a way that a patient, family member, or student can easily understand. We will talk about what GAD really is, how it shows up, what happens in the brain and body, psychological and social root causes, medical and substance-related causes, treatment options, nutrition, vitamins and supplements, when anxiety becomes an emergency, and how to explain GAD to patients without shame. Short disclaimer: this video is for education only. It is not medical advice, diagnosis, or treatment. If you or someone you know is struggling with severe anxiety, panic, or suicidal thoughts, please seek help from a licensed healthcare professional or call 988 in the US for the Suicide and Crisis Lifeline. Generalized anxiety disorder is more than normal worry. GAD is when the brain's worry alarm keeps ringing, even when there is no immediate danger. It's like having too many browser tabs open in your mind, and one of them is playing scary music, but you cannot find which tab it is. People with GAD may worry about everything, from health and money to things that probably will never happen, but still feel possible at tour.m. To be formally diagnosed with GAD according to the DSM-5-TR, a person must experience excessive anxiety and worry occurring more days than not for at least 6 months. The individual finds it difficult to control the worry. Additionally, the anxiety is associated with 3 or more of the following 6 symptoms: restlessness, being easily fatigued, difficulty concentrating, irritability, muscle tension, or sleep disturbance. Finally, these symptoms must cause clinically significant distress or impairment in important areas of life. Let's separate normal worry from GAD. Normal worry says, I have a test tomorrow, let me study. GAD says, what if I fail the class? What if I never graduate? What if I become homeless? Normal worry is like a smoke alarm that goes off when there is smoke. GAD is like a smoke alarm that goes off because someone made toast in another zip code. GAD spreads like spilled juice on a table. It starts in one place and somehow reaches everything. GAD affects the mind, body, and behavior. Mental symptoms include excessive worry, irritability, and racing thoughts. Physical symptoms include muscle tension, headaches, stomach upset, and fatigue. GAD is like having a personal assistant in your brain whose only job is to schedule disasters. Monday, work. Tuesday, health. Wednesday, that awkward thing you said in 2017. Anxiety is busy, but busy does not mean productive. Now let's talk about the brain. In GAD, the brain's threat detection system becomes too sensitive. The amygdala, our alarm system, becomes overactive. A delayed text becomes, what if they are mad? A headache becomes, what if something is seriously wrong? The amygdala in GAD is like a smoke detector that goes off when you boil water. The feeling is real, but the danger may be exaggerated. The prefrontal cortex is the brain's wise coach. It tries to say, let's slow down. But when anxiety gets loud, the coach is drowned out. It's like trying to give a calm lecture while a fire alarm is screaming. GAD turns the thinking brain into a full-time what-if machine, surfing through endless questions instead of problem solving. One of the biggest psychological roots is intolerance of uncertainty. GAD wants 100% certainty in a world that only offers reasonable probability. There's also catastrophic thinking, turning a small spark into a full Hollywood disaster movie. We also see over-responsibility, where the person feels like the unpaid manager of the entire universe, thinking their worry prevents problems. Anxiety can be learned in families or worsened by chronic stress, like financial pressure. Social media also turns the nervous system into a group chat with no mute button. Don't forget medical causes: thyroid disease, heart rhythm problems, or substances like caffeine and nicotine. Anxiety assessment is detective work. Do not arrest the first suspect, interview the whole room. The good news is that GAD is treatable. CBT helps patients fact-check anxiety's breaking news alerts. Tools like Worry Time teach the brain boundaries, scheduling 20 minutes to worry so it stops barging into every meeting. Recovery means learning that uncertainty is uncomfortable, not automatically unsafe. We help them take small, planned, brave steps. Medication like SSRIs or buspirone can help. Buspirone isn't a fire extinguisher, it's more like installing better wiring over time. Lifestyle also supports recovery: regular sleep, reducing caffeine, and movement. Remember, natural does not always mean safe. A rattlesnake is natural, but we don't put it in a smoothie. Always talk to a provider before starting supplements. Seek urgent help for suicidal thoughts or chest pain. When talking to patients, avoid saying, "just relax." Shame makes anxiety louder. Validation helps the nervous system listen. Explain it like an overprotective guard dog that needs retraining. Use the anxiety acronym: alarm overactive, nervous symptoms, excessive worry, impairment, energy drained, tension, and yet what if thinking. Generalized anxiety disorder is common and exhausting, but treatable. My name is Dr. Ben Osevwe. For support, text 832-991-6516 or join our mentorship family at rotationmatchnetwork.com. Thank you for watching, and remember, anxiety may be loud, but with treatment, skills, support, and practice, it does not have to be in charge.